Thank you, Richard, for being here. We're going to have a conversation about vaccines, which I think are on many people's minds. Can you just start us off by talking about how did we get here? How did we get to this moment, and why are we here?
Sure. So this is a very challenging moment for vaccines, and thank you for having me as a part of this conversation. I know that vaccines are not really the main theme of the day, but we're at a really concerning major national inflection point in vaccines, and I think it's really important as we have this conversation that we think about where we've been in the past and how we got here. Vaccine hesitancy is not new, and vaccine misinformation is not new. But we really, I think, saw the exponential, dissemination of vaccine misinformation and disinformation. Following, there was a paper in 1998 published by a man named Andrew Wakefield that really perpetuated this mythical link between vaccines and autism. And that paper, while it was retracted from The Lancet, it was one of those things that you can't put back in the bottle. And social media, the reporting around that paper, and then the amplification of that through social media, and then the more general amplification through social media of vaccine misinformation and disinformation is really a large part of how we got here. And then we have a health secretary, our nation's chief health officer, who unfortunately has been one of the pillars of the anti-vaccine movement and has been a part of further disseminating that misinformation and disinformation. And I do think that the COVID pandemic, we all experienced this collective fatigue, and I think that the fatigue combined with, in some pockets of the country, frustration over how we communicated about pandemic measures certainly fed into that. Not to mention the populist movement that put Donald Trump back in office.
So, Richard, can you talk about what the states are doing or what the states could be doing around vaccine policy at this juncture?
Sure. So we really are going to see a major federalism shift, and I think that states will play a very critical role in ensuring that we have viable vaccine policies going forward. But it's going to be a mixed bag. States are different. We have red states and blue states. We have states that want to wield their public health powers for good, and some that don't. If you look to Florida, it's very concerning that you have a chief health officer there that, much like the secretary, disseminates misinformation and disinformation. And while states have this great power to improve public health, protect public health, not all states will wield that power that way. And in fact, I think people are surprised to learn that legally, states are not required to do that. So it will take leadership in the states that are willing to step up and protect public health. They will have to ensure that we have accurate information, that we're sharing that information with the public, and that we're implementing policies that protect public health. States are going to have to shore up insurance coverage and ensure that there are clear recommendations. And we're starting to see that in some corners of the country. But states are going to play a really critical role, for better or for worse. I would love to see better leadership at the federal level, but I think it's going to be a long time before we get that back.
And what about this moment? Have you ever seen anything with regard to vaccines happening like we see happening today? Is there any historical reference?
Sure. Well, I haven't in my lifetime, for sure. But if you look back across history, vaccines and precursors to vaccines have not always been popular. These were very unpleasant procedures. The old concept of variolation, where people had these things, smallpox scabs ground up and blown into their nose, that wasn't very pleasant. That wasn't very popular. And so there was always objection. And back in the 1800s, as we started to implement mandatory vaccination policies, there was a lot of resistance. And I think there was acceptance only to the point that we had to do that to stop outbreaks. And then once outbreaks subsided, we saw the rollback of a lot of those policies because the public was really tired of those, of being forced to be vaccinated. And we did forcibly vaccinate some individuals back in the 1800s. But I think we regained confidence in vaccination. And ultimately, throughout the 20th century, we were able to have good, strong policies. And I think we'll get back to a point where we have public confidence. And unfortunately, I think part of the way that we'll get there will involve a lot of morbidity and mortality that was really avoidable.
So can you give us some thoughts about what we could be doing now to rebuild confidence and to sort of engage the public in this vaccine issue? Sure.
I think we have a long way to go. And I think Robert F. Kennedy Jr. Exiting the role of HHS Secretary will be a great day. Hopefully that day comes soon. I think some recapturing of public confidence in vaccines and public health will be regained, I think, after this administration is out of office. Some of it will take decades, some of it will take a generation. But we need to, and the public health enterprise needs to work really hard to do a better job of communicating evidence and just translating science for the general public. We talk about 90% herd immunity. Well, how about we translate that into we need 9 out of 10 people in this community to have immunity so that we don't have measles outbreaks. And we have to make that translation for the general public. We have to make that translation for legislators. And I mean, that really has to happen at the community level and the legislative districts at the state level. You have to make it, for policymakers, you really have to make it about their constituency. There was a member of Congress last year that said the way the American people understand efficacy and the way the FDA does and the way the FDA communicates about it are two different things. We have to be mindful of that. We have to come down off of the ivory tower, and we have to work to communicate better with the American people. We have an obligation to do that.
Thank you, Richard. Thank you so much for those comments.
Thank you so much.
Next, we're going to hand the program back to Josh in conversation with Yolanda Jacobs, President of the American Federation of Government Employees, Local 2883, the union representing CDC workers, for a very timely discussion on protecting public health. Thank you.
Great.